Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. How are you?
I'm spunky and living it up.
Oh, spunky. That's a new word you added.
I know.
I like it. Well, we want our listeners to feel like how we feel. So, do give us a call if you're experiencing any kind of musculoskeletal pain today. And that means joint pain, tendon pain, ligament pain, back or neck pain, disc pain, knee, hip pain, arthritis pain, maybe carpal tunnel syndrome pain, tendinitis, dull aches, stiff joints. Basically, we're talking about orthopedics here on Living Pain-Free, and we want you to live pain-free. When you call the program today, you get Dr. Darrow's latest book for free that explains all of the treatments in great detail with 264 scientific studies. The foreword is written by Suzanne Summers, and you can call us all hour long at 866-870-5752 here in the studio and speak live with Dr. Darrow. And check out the website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on video. We are here every Saturday at 10 a.m. and again at 1 p.m. But give us a call now. I have lines open for you right here at the station, 866-870-5752. What do you think?
Well, I'm excited to help educate people on how they can heal without surgery. We know there are way too many surgeries being done. My book, Stem Cell and Platelet Therapy, has a lot of studies on the failures of surgery. These are not failures of the surgeons. I have to make that clear. The surgeons are great guys, and I love them. They do the hardest work in medicine. So this is not against you folks. It's against the surgeries. Too many of them fail. And when there's a surgical failure, there could be just about anything. We had a woman come in whose husband died after a neck surgery. Remember that one last year?
Yeah, that was Christmas
crazy.
time. It was awful.
Yeah, it was terrible. So what do we get? We get sometimes infections. We get one leg shorter than the other. When there's a joint replacement, we end up, let's say you do a knee surgery, you end up with back pain. It's just too many things go on that I shudder from. I have patients come in all the time that have had things happen to them. Actually, you know what? I just had a question come in about that.
Oh, good. Go for it.
Is it okay if I just take one right now?
Sure.
Okay. So this person says, I'm currently severely disabled. By the way, cut me off if we get a caller in here, which I think...
Oh, we have...
Let's do Deborah.
Okay, let's talk to Deborah first.
Let's do Deborah, because this other email is kind of long, and it's about a guy who had multiple surgeries on his back and is worse every single time. Okay. But anyway, Deborah, let's go to you. This is Dr. Marc Darrow, and your husband has his back is bothering him. Is that the case?
Yes.
How long has his back bothered him for?
Since March.
Okay.
Or longer. He has an issue with C5 in his neck. He has deteriorating discs and a bulging deteriorating vertebrae, I guess, and a bulging disc and a couple of bone spurs.
Okay.
And we just saw a doctor yesterday to see about surgery, but I had heard about you a long time ago. And I was trying to get my sister to call you, and now my husband's going through this, and I thought, and another person I know did stem cell on their foot, a member of her family, and that helped her. I mean, the pain went away. So I thought, well, I don't know exactly what's involved or if it is anything that you could help him with, but from what I understand, I think that he was saying that the bones can actually be regenerated by doing a stem cell. Is that right?
Yeah, let me ask you some questions and talk about this a bit. You mentioned that his back bothers him, but then you mentioned his neck. So is it mainly his neck or his low back or where?
Well, it's his upper back, I guess. It's C5, wherever that's located.
Yeah, C5 is the bottom of the neck. Yeah, we do stem cells, platelets for treatments on necks every day, and backs also. Every joint in the body we can work with. We can take care of neck pain, back pain, but shoulders and elbows and muscle and tendons and ligaments, hip arthritis, knee arthritis, foot problems, plantar fasciitis, toe pain, you name it. So the reason we can work in all these areas is because all we're doing is stimulating new tissue to grow. And we can use platelets from your blood or stem cells from your bone marrow to do that. And it just depends on the severity of the injury or the overuse or arthritis or what it is that will help us depend on what we're going to do.
Him. He's going to be 70, and he still climbs on ladders, and he does refrigeration, and he's bending and getting into pretzel positions and everything. So he's definitely physical, and I think he's just worn himself out. Not only that, but cooking a lot, bending over and doing that, salting.
Well, it's like I always tell patients, you're like a expensive Ferrari with the tires wearing down from racing a lot. And we can, as an analogy, retread the tires in a lot of situations. So a lot of these things that your husband has, degenerative discs, don't really cause pain. Bulging discs don't really cause pain. And usually when people come in with those syndromes, those are not the issues. Okay, a lot of people have bulging discs and degenerative discs, and they have no pain. So don't get caught up in the seduction.
Being pinched.
Sorry, I have to touch. I have to.
That's being pinched.
I hear that, and I hear that it may not be the truth of what's going on. So I need to touch my patient's body in the area that they're having a problem and see what is really going on. I can't diagnose from an MRI or an X-ray, which is what most doctors do, unfortunately, and then most patients get a surgery they did not need and it didn't help. So we have to be very cautious to examine the body, use our hands, never get a surgery based on just an MRI or an X-ray, unless there's a broken bone or something like that, where you need to get a surgery and have it pinned up. So there's good hope for your husband that he may be in the category of someone that I can help with regenerative medicine, using his own cells from his own body and just having him walk in the office, get injected, and walk out, and then healing.
Oh, wow.
So, yeah, I appreciate your call, Deborah. It sounds like your husband might be a good candidate, but again, he would have to come in the office. I'm going to give you the phone number to the office so you can jot it down, and everybody listening can jot this down. And there are people by the phones who can take your questions. So the phone number to the office is 800-300-9300. I'm going to repeat it for you. 800-300-9300. And I would love to hear your calls also. And Deborah, thank you so much for calling.
Thank you, Deborah.
We're going to move on here. I've got this question pending that we didn't get to, which is very complex. And again, Nita, if you see a caller on the screen, you can bump me off of this question, and we'll go to a live caller.
Okay.
And the call-in number to the studio right now to talk to me, and I wish you would, I'd love to hear from you, is 866-870-5752. I'm going to repeat it, 866-870-5752. Please call me now. If you're shy, you don't need to be. You can use a phony name or pretend it's a neighbor you're talking about or a family member. You can always go to my website, and you can email me from every page on the website. It's got a lot of information. The website has videos of me doing these procedures. You can watch, see if it's something you may want to do. And the web number or the website name is www.lastemcells.com. www.lastemcells.com. So while we're waiting for callers, I'm going to go to this kind of long email, but I'll try to get through it. So this person says, I'm currently severely disabled by back pain. 5 years ago, I had bilateral L4, L5 laminotomy. That means that the back of the vertebrae were cut out for uncontrollable left-sided sciatical pain. The radiculopathy was resolved, but the bone removal was so aggressive that level was destabilized and the disc space collapsed, leading to a spinal fusion. That's a second surgery. I never recovered, but struggled on high-dose oxycodone. We all know what that is.
Right. That's
a narcotic, and that's a medicine that once you're on it, that's bad news. In early... this is 2 years ago, the pain became worse to the point I sought further options from new neurosurgeons and orthopedic surgeons. I was advised that L3-4 and L5-S1 showed dark black imaging on MRIs and displayed vacuum phenomena. That means that they were collapsing, it looks like. I was advised to either have further fusions, but one orthopedic surgeon offered artificial disc replacements, and I've had several people come in the office with those where they have failed. I'm not saying they always fail. I'm just saying, which I always say, watch out when you have a surgery because things can get worse because of it, which I opted for because I was in severe pain. The surgeon also suggested removing existing L4-5 fusion instrumentation as he believed that was contributing to the pain. Upon awakening from the surgery, the moment I moved, the L4-5 area proved to be a pseudoarthrosis. Pseudoarthrosis means the fusion failed. It wasn't a good fusion. Okay, it looked like it was fused on an X-ray probably or an MRI, but it wasn't strong enough and it failed. Okay, so what's that? Surgery 3? Never fused inside. Okay. On the CT scan, it showed it was just superficial. And within days, both L3-4 and L5-S1 disc replacements became loose and migrated from alignment. That means they moved out of their place where they were placed. Okay? Whoa. So then a year ago, I had severely damaged L3, L4, L5-S1 levels, which resulted in rescue posterior lateral lumbar fusion from L3 to S2. Now, what is that? Surgery 4?
Correct.
You keep count.
I am.
The surgery was done as posterior lumbar fusion, but without any decompression or interbody device implants. The pain was even worse following this surgery, and despite intensive PT and several rounds of steroid injections, it never resolved. I was 99% housebound, unable to walk more than a block to get groceries and basic needs. I tried dozens of dry needling sessions to try to ease soft tissue, multifidus, paraspinal, and quadratus pain, that's the muscle pain, to no avail. Recently, I started dextrose prolotherapy treatment in desperation, and dextrose prolotherapy is using sugar water to irritate the tissue and bring fibroblasts to the area. By the way, this is just my comment. And thicken up the tissue and heal the tissue that way and then get rid of the pain. I tried dozens of dry needling sessions. What else here? First 2 sessions left me extremely sore and severely weakened trunk pain, unable to mobilize to stand erect. Okay? Third session was a disaster. Had medial block branch ablations, so they burned the nerves. had ketamine infusions. That's a very strong drug, without relief. 4 weeks ago, I had a further fusion extension. What number is that now, Nita?
That would be surgery number 5, yeah.
I'm now still hospitalized with severe pain in the same original area. I'm wondering if PRP or stem cell therapy can help. I'm awaiting further pain management treatment in the form of lumbar sympathetic blocks and erector spinae plane blocks. Your time and advice is sincerely appreciated. Well, I don't know in this case whether using regenerative medicine, platelets, or stem cells would be appropriate, and I wouldn't know based on all of this information. I would know based on just touching the area, because it is possible, I know this is outrageous, it is possible none of these surgeries ever had to be done. It is possible that regenerative medicine could have been the answer from the beginning. And I'm going to say it like this. If you've got pain in your body and it's suggested that you have surgery, if it were me, I would always try regenerative medicine using PRP or stem cells first, not last, not after destructive surgery. So this guy has had 5 surgeries, it looks like. It's very complex to figure it out even.
Yeah, I think it's 5.
Poor guy.
Yeah.
Yeah. And then some other invasive procedures, burning nerves and other things. And it is possible, I don't know because I haven't had him come in the office yet, but it's possible he could have had regenerative medicine and gotten rid of the pain that way. So I'm a fan of regenerative medicine. I've been using it on my own body for about 22 years. I am an athlete, and I am 72 years old. So, the numbers indicate that if I continue the way I'm going to continue, I'm going to still be using regenerative medicine. To be honest, I did a quick prolotherapy on my shoulder last Monday night. I tweaked it playing golf. Nothing terrible, but it was irritating. And I did one prolotherapy treatment on it, and I'm going to go play golf again today. It feels a lot better. So we have to be careful to choose a conservative form of medicine, no matter what it is we're doing, rather than an invasive form. I see way, way too many people who come into the office, new patients every day, who have had invasive surgeries that have made them worse, and I sympathize with them. It happened to me one time before I knew about regenerative medicine when I was in my 4th year of medical school, and I did have a shoulder surgery, and I'm not going to say it destroyed my shoulder. For the time, it was terrible for several years after that surgery, until I learned about regenerative medicine way back in the day, and I injected my own shoulder, and it was completely healed the next day. I've had a few shoulder injuries since then, and they're all different injuries from different things. The first one was from weightlifting. I've had injuries from playing tennis and playing golf. So it's not like my shoulder is 100% perfect, but it goes through periods of perfection, then I injure it again. I have different weak spots in my body. My neck and back I've injured several times. I've injured my knees several times. And people say, well, why do you have to keep doing regenerative medicine? Because I'm active. And it is possible to re-injure something after it's healed. So it depends how much we're willing to give up the fight, and I'm not willing to give it up. So I do plan on injecting myself in the future when it's needed. Right now I'm good. Right now I'm very grateful. I'm going to go out and do sports most of the day today, and I'm feeling good. And hopefully we can get you feeling better using regenerative medicine instead of doing a surgical procedure, which can lead to various side effects that the regenerative medicine does not have.
And to that end, we want you to call right here at the station, speak with Dr. Darrow at 866-870-5752. That's 866-870-5752. We have lines open for you right now. check out the website at www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page once you get to the site, and you can watch him performing the treatments on videos. There's a lot of science to this. You get the free book, Dr. Darrow's latest, when you call the program today. It's called Stem Cell and Platelet Therapy. Regenerate, don't operate. It has actually 264 scientific studies. So you want to call and get your free book. Same number, 866-870-5752. And you can speak directly with Dr. Darrow. It's a win-win.
It is. And let me talk about a couple things here while this call is being fielded.
Okay.
One is I have a little booklet on hormones, and I treat a lot of people with hormone replacement. Men and women lose their hormones as they age, and it has a lot of terrible side effects to us. We lose our bone density. There's fractures. We have people that have hair loss when their hormones are lost, and we do PRP or stem cells on the head too. And we can also do this procedure on the face to grow back the collagen in the face. It's called, you won't forget this, the vampire facelift.
Love it.
And it's a very cool procedure. So there's a lot of things that these cells from your body can be used on. In the meantime, Nita, I'm going to go to Tony, who is waiting on the phone. He's got wrist pain, I think it is. So, Tony, this is Dr. Marc Darrow, and is it true you have wrist pain?
Yes, correct.
And how long has that bothered you for?
Well, I've got problems with both wrists. One was an injury that happened years ago, and then I had to overuse the other wrist, and I injured it as well. And it's been years, and I don't seem to really have recovered. Maybe I'm just continuing to re-injure it slightly a lot, but I have not recovered.
Yeah, that was my first situation. I had the same type of thing. This is before I knew about regenerative medicine. And my first actual injury that I treated was my wrist. It was my right wrist. And I had, as an adamant golfer, I'd watched all kinds of videos, and one of them was about how to hit a 3-wood over a tree. And the way you did it was to slam down into the ground, hit the ball first and slam down to the ground. So I did that when I was on the golf course because I was behind a tree. And guess what? I didn't hit the ball. I just hit the ground.
My father
and it
hit the wrong ball first.
Yeah, exactly. I hit the wrong ball, the big earth. And so I hyperextended my wrist backwards, and I had tremendous pain. And, it would heal up a bit, and then I'd go play tennis or golf, and it would get worse again. Sounds like what you're doing, where it just never healed. Then finally, I went to a medical conference, and they were talking about how to heal wrists using, this is the old style dextrose prolotherapy. So I had the instructor inject my wrist, and he said it's going to get real stiff, and in 24 hours you're going to feel better. And I was like, yeah, right. Well, he did, and it was real stiff. Felt like I just re-injured it. And 24 hours later, the stiffness broke, and my wrist was 50% better. I was like in shock. I couldn't believe it was real.
24 hours, yeah.
24 hours, 50% better. And then I injected it myself a couple more times and learned how to inject my own body, and I completely healed the wrist. I cannot remember the last time I've had wrist pain. Okay? And I treat wrists almost every day. They heal very quickly. So there is good hope, Tony, for your wrist healing. And listen, I am rough on my wrist. I'm going to be honest. I do all kinds.
Both wrists basically on a gripping and twisting action while I was working.
Yeah.
Okay.
We're going to break,
on.
Tony. Stick with us till after the break. We'll be a couple of minutes, and we can talk to you more, okay? God bless you. Hang with us.
Stay with us, Tony. You're listening to Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil. Write down this important information coming your way. I'm your host, Nita Valenson. We'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.